Dear friends of Norway and Estonia, ladies and gentlemen, it is my great pleasure to welcome you today on this virtual business event. Norway has always been one of Estonia's most important partners. Our relations are strong because of common interests and shared values. This is where I thank everyone here for your contribution in making this relationship also economically beneficial. Today, I do not have an easy message for you. The crisis is not yet over, and there is still much uncertainty about the near future. On the other hand, crisis brings us new opportunities to find better solutions to develop our cooperation. By working together, we can recover more quickly and make progress on areas of mutual interest. We already have many excellent examples of profitable cooperation. Orkla, Reitan Group, Citybox Hotel, Biobag, and others Norwegian companies are well known in Estonia, and I see a great perspective in developing our good economic partnership. This crisis has shown us the importance of essential digital services solutions. Estonia has a great capacity to provide these services on the very high level. The challenges we faced and the opportunities we found can inspire others. Made one of the most advanced digital society in the world, Estonia has built an efficient, secure and transparent ecosystem where 99% of governmental services are online. Our experience shows that in order to raise competitiveness of our societies, the using modern technologies and digital solutions is crucial. And Estonia would be happy to share our experience with you. By joining our efforts, Norway and Estonia can contribute to a better world. I firmly believe in the power of our economic and digital cooperation. Together, we can do it. Let me assure you that we appreciate your contribution and welcome the opportunity to find new ways of cooperation in the future. I welcome your ideas and input. Thank you.
Thank you, Prime Minister Ratas. And with this, we will switch to our studio in Norway. Welcome, Mr. Lauri Bambus and Mrs. Merike Kaesveld.
Thank you, and dear ladies and gentlemen, Honorable Prime Minister Mr. Jüri Ratas, distinguished entrepreneurs, dear friends in Estonia and Norway. It is my great pleasure to welcome all of you to the virtual business visit hosted by the Estonian Investment Agency. As the Estonian ambassadors to Norway, I am truly pleased to see huge interest in bilateral and regional cooperation of Norwegian and Estonian public and private sectors. Estonia and Norway are paying lots of attention to modernization of our societies and well-being of our people. We have to face together the new challenges the world has, inter alia the climate changes, environmental issues, or challenges caused by the pandemics. Together with other Nordic Baltic countries, we may consider our region as one of the most digitalized in the world. And I would proudly argue that we live in the most connected region in Europe, most probably in the whole world. Estonia cherishes a digital and cyber cooperation with all its neighbors and like-minded countries worldwide. Would it be at the Nordic Institute for Interoperability Solutions or developing and implementing the X-Road, cross-border digital services to support cross-border education, working or business activities, or just the day-to-day e-services, either bilateral, regional, or on a global scale. The current crisis has stressed the importance of digitalization as a tool to strengthen the resilience of affected states and societies. Therefore, I'm truly pleased to see close and constantly enhancing cooperation between our countries, Norway and Estonia, as well in the whole Nordic Baltic region. Dear ladies and gentlemen, the Estonian embassy in Oslo our active honorary consuls in Norway, and me personally have always great honor and pleasure to point out the long-lasting Estonian-Norwegian cooperation we have had more than 100 years. Next year, in February 2021, we will celebrate the centenary of establishing the diplomatic relations between Estonia and Norway. Last week, I had the pleasure to meet Ms. Linda Catherine Hofstad Helleland, Minister of Districts and Digitalization of Norway, and discuss our wide range of cooperation on digitalization of different spheres of life, including those we focus at the virtual visit today, namely HealthTech, FinTech, and CleanTech. However, the list of areas where the new technologies have the utmost importance is much longer. Having this opportunity, let me continue just naming few more. Green tech and smart mobility. That we shall focus on Friday, the 11th of December, when two foreign ministers, Mr. Urmas Reinsalu and Ms. Ine Eriksen-Søreide, will open another virtual meeting between Estonia and Norway. Dear friends, you are also very much welcome to join this event online or follow the recording later. I would like to take this opportunity to assure you that the Estonian Embassy in Oslo, as well as our counterpartners at the Norwegian Embassy in Tallinn, are in your service. Although this year we have had less physical meetings, I would like to believe that next year we will have many more opportunities to enhance our mutually beneficial relations. Let's start and continue to build the new bridges of cooperation today. In these globally complicated times when the coronavirus is challenging all of us, especially in the economic sector, we should use this opportunity to seek joint solutions to improve the digital services our countries, nationals, and companies use. I'm sure that with joint efforts, we will become a model region for the whole world. Thank you for your work and dedication. Dear friends, I wish you all a fruitful day, lots of success and happiness for you and your closest. Stay safe and healthy. Wishing you a joyful Christmas season and a prosperous 2021. Edu ja kordaminekuid, tusen takko, thank you. And now I would like to give the floor to Merike, please.
Hello, my name is Merike Kaesveld, and I'm representing the Estonian Investment Agency. First of all, I would like to thank all the speakers who are taking part in today's event, and special thanks to our partner from Norway, company Explorica, and my colleagues from the Tallinn team who put a lot of effort into making this happen. The Estonian Investment Agency is a unit of Enterprise Estonia, the country's largest support institution for business and entrepreneurship. Estonia is a global leader in the highest number of startups per capita and also has the highest number of unicorns per capita. Estonian startups have raised a total of nearly 1 billion euro in the last 10 years. The increased interest of foreign investors confirms that Estonian startups are being noticed globally. We have a strong startup ecosystem and credible, transparent business environment. Based on the crowdsourced database and Estonian startup database, a total of 142.7 million euro was invested into Estonian startups during the first half of this year. In total, there have been 35 new investment deals this year. The biggest investment in the first half of 2020 was raised by Bolt, 1 million euro, followed by Veriff, 18 million euro, Pactum, 2.7 million euro, and Milrem Robotics, 2.7 million euro. We are the land of unicorns. So far, Estonia has produced 5 unicorns. No other small country has that many. They are well-known Skype, Playtech, TransferWise, Bolt, and Pipedrive, who achieved unicorn status in November 2020. Estonia has a busy supportive and open startup ecosystem with over 1,000 startups and 110 organizations, providing a wide range of services for startups. There are more than 500 events annually. The best known are a startup in Tartu, Latitude 59 in Tallinn, and Robotex in Tallinn. I believe that today will be equally interesting for both parties. Hopefully, this event will lead to many beneficial collaborations. I wish you all a productive day and Merry Christmas. Thank you. And now back to Tallinn studio.
Thank you, Ambassador Bambus. Thank you, Mrs. Kaisveld. And with this, we will actually move on to the main segments of the day. So first of all, we will have HealthTech, followed by CleanTech, and then in the end, FinTech. After each segment, we will actually have a short break as well with a very special musical treat for you. And now, with this, we will move forward with the HealthTech segment of the day. I will give word to Mrs. Lina Svensberg from the Accelerator Program at DigitalWell Ventures and Mr. David Holm, Investment Manager at DigitalWell Ventures.
Thank you very much for inviting us to meet Estonia, the virtual state visit from Estonia to Norway. My name is David Holm and I'm the investment manager at DigitalWell Ventures.
And my name is Lina Svensberg and I'm the program manager of DigitalWell Ventures.
So we're here today to talk about DigitalWell Venture, which is a dual location accelerator between Norway and Sweden, where we work with health tech digital startups within the fields of emerging tech and all kinds of digital e-health kind of solutions. And I'll get back to the details pretty soon and see how DigitalWell Venture can work with the Baltic states and Estonia in particular. But before that, my colleague here, Lina, is going to tell a little bit about DigitalWell Arena and how this all fits in.
Yes, DigitalWell Arena is a 10-year initiative funded mainly by the Swedish Innovation Agency with a budget of total 15 million euros, and it runs over 10 years, and we are within this initiative addressing the challenges that we face within digital health and welfare. We're able to try to increase the use of digital technology and data in the vertical of health. And that is something that we do together with universities, with the public sector, with the private sector, etc. And that initiative has given us the opportunity to also work with startups within digital health. And David, could you tell us a little bit more about how exactly do we do that?
Exactly, and starting with the challenges that we actually do address, we're talking about, for example, public tenders, where we see that startups and small companies in general have a tendency to be left out because the big companies are accessing most of the contracts and the deals. So what we want to do is to ease the flow of purchasing from the government, and we're doing that as a part of the actual program, where we actually work with the government on one side to enable startups to actually qualify for tenders and participate in tenders, and at the same time we're offering the startups to have real-life test beds, so they can actually test their MVP live at public instances. That could be municipal test beds, it could be regional hospitals, or even state-driven initiatives.
And so tell me a little bit more about, now we're talking about the collaboration with the Baltic countries. We're saying that we're addressing startups in the new Nordics. What do we mean by that, David?
Exactly. First of all, I must say that it's very important for us to define what is the new Nordics. And most of you here today know that we have the Nordics and we have the Baltics, but the term new Nordics is actually quite new. And this is where we include the three Baltic states to the Nordic status. And why do we do that? It's because we think we have very close cultural integration between our 8 countries. From our own, how shall I say, egoistic perspective, looking at DigitalWell Ventures, we need to have a strong quality of deal flow. And the Nordics is too small for that. But when we include the Baltics and the quality that we've seen in the Baltic startups, I think we really have something going here.
Definitely. So tell us a bit about the deal flow. I mean, we are not only just an accelerator, are we?
Exactly. So basically what we're doing is that we're working with the government as well. So sometimes official government entities have a problem that needs innovation. So that's actually part of the accelerated thinking as well. It's not only demand driven by one side, it's also from the government and from the startup. So for example, if the government have a problem, we can actually include that problem into the accelerated thinking, and we can actually come up with a solution together with the startups. So it's a two-way problem-solving entity, so to speak.
Exactly, and what we can do then also is that we can help the government communicating the demands that they have. I mean, it's not so easy for the startup to know how to tick all the boxes that are needed in order to address for example, a hospital as a client. And we can facilitate that communication, which means that we can make it easier for the public sector to communicate their demands. And we can also make it easier for the startups with testing it in the public sector, while also educating the receivers on the other side on how you test digital solutions and how you can feedback that. Which means that we can actually use a lean startup approach into a business to government setting, which is fairly unique.
Now we're talking a lot about test beds, Lina. Obviously, there's a lot of challenges as well as opportunities in participating here. And if you look at the USPs, the unique selling propositions that we have in DigitalWell Arena, what would you say is more USP rather than just the test beds? Is there other things that makes our offering unique?
It definitely is. I mean, the geolocation setting that we already have with the collaboration between Sweden and Norway means that you get two markets straight away. So the internationalization is kind of included in the package. We also have, instead of an incubator, which normally runs over a couple of years, and an accelerator program that runs over maybe 16 weeks, we have merged those two concepts into a 10-month program where you, 1 day a week, you focus on the accelerator work, and then you have 4 days a week to run your normal business. What other USPs do you see, David?
Well, apart from obviously the testing and the flexibility in the program, I think the cross-border sort of approach to it, not only between Norway and Sweden, but also between the Baltics and the Nordics. So obviously we're looking at deal flow from all 8 countries. We're looking at innovation when it comes to academic cooperation. We're looking at we're working around the pentahelix model, which means that we have to include investors as well in this. So looking at investors in 8 different countries, I think it's a very interesting proposition from startups from 8 countries as well. So we pull that together and match it. So I think cross-border collaboration between the 8 countries is extremely important. Definitely. Okay, so to all of you out there, we actually invite you to get in touch with DigitalWell Ventures, and whether you're a startup, you're an investor, you're a government entity that needs help with innovating on a problem, get in touch with us and we'll help you out.
Yes, thanks a lot.
Thank you very much. Thank you.
Thank you, Lina. Thank you, David. And with this, we are actually coming back to our studio here in Tallinn. I have on stage here with me Ms. Piret Hirv from the Connected Health Cluster. Piret, the floor is yours.
Thank you, Oliver. Thank you. And good morning also from my side. Yes, my name is Piret Hirv and I'm working for Connected Health Cluster, and we are operating in Tallinn Science Park Tehnopole, which is a foundation owned by the city of Tallinn, our government, and also TalTech, our university next door. And why this combination is important? It's not an easy task to implement novel solutions in healthcare, and for that you need collaboration from all the stakeholders. And in our Science Park Tehnopole, we can combine also state level, municipality, and we have good partners in academia. HealthTech is not the only focus field. We also work with green technology and ICT and smart city solutions, but closer to my heart is HealthTech. And the question is how to boost innovation. There are a lot of barriers, actually, to implement innovative solutions in healthcare. There are funding issues, evidence issues, how to validate your solution. And actually, one of the main things we are working in our cluster is involvement of end users. You need to involve end users in order to implement innovative solutions in health tech or healthcare. And for that, we have established an ecosystem which is called Connected Health Cluster. And in this health tech community, we have combined forces from all the stakeholders in healthcare provision of healthcare solutions. In our community, you can meet health IT companies, bigger ones like Nortal and Helmes, really giant companies. You can meet health startups, smaller companies, but very fast developing, very innovative, providing very innovative solutions. How do you know how to solve problems in healthcare? You do need a contact, very good contact with healthcare providers. So this is also part of our community. Healthcare providers on the primary level, healthcare level, like family doctors. We have good contacts with the hospitals. We have good contacts with all kinds of specialists. We do collaborate with the university, and not only with our neighbor University of Technology, but also University in Tartu, where we have young doctors studying, or also universities where we can collaborate with the nurses. In Estonia, at least, you cannot implement any of the solutions in healthcare without a good contact and collaboration with public sector, and we have pretty good contact with our Ministry of Social Affairs, Health Insurance Fund, and other public entities. You can also see that we collaborate with pharmaceutical industry, and actually they are not our good partners because they need some kind of support or guidance, but the pharmaceutical industry is really keen to develop innovative solutions in healthcare, and that's why they are also part of our community. We have been, we are still going or living through really hectic times. And once this, the situation started in spring, I received a lot of phone calls, a lot of emails, how your companies are dealing with the virus, with the crisis, how you are preparing for this. And also our minister, Prime Minister Jüri Ratas said that this COVID situation made us to realize that innovation or remote services is the key. Unfortunately, I have to say that we were ready already a long time before the outbreak of COVID-19, and we did not develop any specific solutions for the crisis, but for our solutions, our public started to realize that innovation is the key also in healthcare. How we support our companies? We start with the idea creation. We support companies with the prototyping. We actually do have funds for prototyping, so companies can actually test their ideas and see if there is any kick or any sustainable idea behind their solution. We do support startups in our startup incubator. By support, I mean that we do have really wide network of mentors. We prepare our startups to be ready for the real life and for the real business, including doing business in healthcare. We support our companies with the marketing activities. We do support international ambitions. So pushing our solutions to the foreign markets is one of our key elements in our ecosystem. Because Estonia is a beautiful place where to live, but you need to develop those solutions for the international market, because our beautiful home is just too small for that. And then we come back to the with the circle with idea creation, with hackathons, where we try to find those brilliant ideas to push to this Prototron program again and start prototyping. And this is the circle we are covering in our Connected Health Cluster and Tehnopol. So yes, today you will meet few of our members, and they will present their innovative solutions. But this is where you can find me. So this is where innovation lives here in Estonia, and you can find all our members on our website and contact them directly. Thank you.
Thank you, Piret, for this great overview of the Estonian Connected Health Cluster. And with this, we are actually moving back to Norway. Calling in is Mr. Jeremy McCrohan, representing Norway HealthTech.
Thank you very much for the introduction. It's been really interesting to see some of the other talks, and I learned a lot. I learned that Estonia had the highest number of unicorns per capita, which is great, and New Nordics. I have to look more about that. I definitely agree with cross-border collaboration with investors. So my name is Jeremy McCrohan. I'm the head of investor relations for Norway HealthTech, as you can see in the logo there. And also I lead the development of the Norwegian Health Investor Network. I'm really happy and privileged to be here today with such a distinguished group of presenters. Thank you to the Estonian Investment Agency and Enterprise Estonia for arranging this virtual visit. I think it's a great idea. And thanks to David Holm and Stefan Peterson for inviting me to speak. I'll be overviewing the Norwegian health ecosystem through an investment lens. So a little bit about Norway HealthTech, just briefly, who we are. So we're Norway's longest running health cluster. We've been going for around 10 years. We're a not-for-profit organisation. We have roughly 260 members from the entire value chain of the health sector. And we help our members in multiple ways through regulatory advice, access to a network both in Norway and beyond, grants, grant writing capabilities, and importantly, fundraising. So my role with the companies, specifically within Norway HealthTech, is to prepare them for investor interactions and to help them and assist them during the fundraising process. You can see in the slide here on the right-hand side, you can see some of the activities and projects and events that we run throughout the year, or the number of events we run throughout the year. We're very active as a cluster and an organisation, which is basically about getting in touch with our members and getting them to help each other and create a real collaboration in the community there, which also extends to the larger health ecosystem and not just our members. On the left-hand side there, you can see that we have members from different categories. So we have academia, clusters and TTOs, a large chunk of incumbent companies, which helps with that knowledge transfer from startups to incumbents and also helps the industry. We've got hospitals, municipalities, and importantly, you can see that number down the bottom there, 160. They're our SMEs. So they're all early stage, health-focused companies bringing life-saving solutions to market. So that's the sort of the essence of what Norway HealthTech is and the cluster. As I mentioned, I also, which I thought might be interesting today to talk about, was the Norwegian Health Investor Network, which I'm helping to lead or develop in Norway. So basically, it aims to increase the amount of private investment that's coming into the health sector and to fill the gap in funding that's missing. So from the ecosystem, which is around seed and earlier A stages. So we're pretty good at early stage. We're pretty good at the later fundraising, but in the middle there, we've got a bit of a gap, and hopefully this investor network will attract investors to help fill that gap. So we've onboarded a number of clusters and TTOs to try to ensure that we have a national network. So a lot of these organizations and the logos you see here are from various parts of Norway, and they're from various backgrounds. So we have clusters, TTOs, which are tech transfer offices. I'll get to an explanation of that in a minute for those of you who don't know what a TTO is. And we have an incubator there as well in Alip. So all these organizations are natural attractors for health-focused companies and emerging health companies. So just to give you an idea of the deal flow, just the top two logos there, which is Norway HealthTech and the Smart Care Cluster, they have, between us, we have 150 companies each. So between us, we have over 300 health-focused SMEs that are bringing solutions to market. Where we are with this activity is we're currently onboarding both companies and investors. We have a growing number of both. And we basically, the idea is to consolidate the best health-focused deals and opportunities from across Norway and attract investors, not just from Norway, but from a worldwide perspective, to come and look at the Nordics and look at Norway to help foster and increase that amount of investment coming into these companies and help them get to market and to flourish and scale. We have plans to expand the network activities beyond Norway to the Nordics and even beyond that, which may even include Estonia. And we've had a number of companies coming from Estonia to ask us for help in finding fundraising, so finding investors and wanting to collaborate. So I think that there's definitely something that we should talk more about into the future. Okay, I just wanted to overview the health ecosystem and the actors within it for those of you who might not know. So some of the key stats on the left-hand side there, we get that from a report that comes out every year from a company called Menon. If you want more of those stats, I recommend that you go and have a look at that report. But I think two of the key findings, I think, from that report for me, that we have roughly on average 10% annual growth in the sector and 10% growth in the number of startups. And that was done earlier this year, these figures. So I suspect that we'll probably have a higher rate based on the coronavirus and companies bringing solutions to market. If you look at the graphic there, some of the some of the players are listed here, or most of the key players. So I'll just go through them very briefly for you. So we have the academic players, which are the universities, the university hospitals, such as Oslo University Hospital and NTNU. We have TTOs, which are not listed here, but they're definitely an integral part of the ecosystem. So basically, they work with universities, hospitals, researchers to support spin-outs and guide companies and ideas through from an idea to commercialization. So they're very supportive in that way. We have research institutes, which play an important role. Policymakers, both at a high level and at a municipality level. We have companies, both large and small, hospitals, and importantly, we have capital, which is obviously a really key part of making this ecosystem run smoothly and to grow and flourish and get to where we want to get to. So let's talk about that for a second. So on the right-hand side here, we'll start with public funders. So that's grants and funding schemes for companies. So the key players within Norway, which are helping companies from public funding perspective, is the Research Council of Norway. They help companies with research and innovation, as the name would suggest. And Innovation Norway, which helps companies with innovation and the next stage of commercialization. So Innovation Norway has a number of funding schemes from very early on in the company's life cycle to later on and all the way along. We have SIVA, which helps on more of a structural level, so access to incubators and facilities and partners for companies that are in this sector. We have regional funding, so each region has their own funding sources. And more we're relying on EU grant funding. It's becoming quite a large chunk of helping these companies. So basically, you can start with a national grant with your company, but you're definitely going to need a larger, or to tap into EU grant funding or private capital if you're going to grow and scale your company, in my opinion. So we also have the private players on the left-hand side there. So you've got the usual suspects, the VCs, the family offices, angels, and the PE firms. So I'll just touch on the VC firms just briefly. So the main players who get involved in deals and early stage deals from a health perspective in Norway would be Investinor, Carnica, Sarsia Seed, Hadean Ventures, Serendipity, to name a few. So we're pretty good, I think I mentioned, at the pre-seed stage and the later stage. We have them reasonably covered from a private and public funding perspective, but we need more professional funds which are going to cover the seed and early Series A stages. So it's something the industry, I think, is working on, and there's emerging funds that are going to be focusing on that area. We have a growing number of players that are interested in the health sector, and I think that's one of the silver linings of COVID-19, which is, for example, family offices who have traditionally focused on shipping and made a lot of money with oil and gas and aquaculture, those sort of categories, are now looking to allocate some of their capital to the healthcare sector, which is the fastest growing sector in Norway. And obviously, a lot of opportunities are emerging now. And what we hope to do with the Norwegian Health Investor Network is to give some of those investors who might not have looked at this sector before a soft landing for seeing pre-qualified deals and getting in touch with co-investors to help them to navigate this sector in terms of investing. Some of the bigger transactions we've seen throughout this year, which I thought might be interesting to mention, is Vaccibody, a company that had secured the largest biotech deal that Norway has ever seen and listed their company for 16 billion kroner this year. And we've got a success story in Bergen Bio, which raised 500 million NOK in an oversubscribed private placement early in this year in May. And just as another interesting fact, Investinor divested from a company called Caladitas, a Swedish company, and they gained more than 475 million NOK from that one transaction. And that's the largest amount of money they've made from a single transaction since their inception. And it also indicates the fact that it's a Swedish company. It indicates a willingness to invest internationally, even though they're not mandated to do it. So potentially Estonia into the future as well. I've also seen personally an increase in the amount of interest from large international VC firms looking at the Nordics. So you've got a new fund, EIR, which entered the market, but we have big international US and UK firms which are asking me for deal flow and telling me that they're focused on the Nordics, asking me for doing roadshows and setting them up so that they can see the deals that are happening. So I think there's a focus on the quality that's being produced here, and the world is looking at it. Also, corporate VC firms like Roche and J&J are also interested in the area. Just very briefly before I finish up, I was just looking at what makes Norway a good place to do business, and I came across these two rankings. So which were just out of interest. So we're ranked number 1 in the Resilience Index, which is basically indicating a strong economy, productivity, stability, low corruption, etc. And I think we've had that 2 years running. And we're ranked number 9 in the ease of doing business, which is basically starting a business, enforcing contracts, trade across border is another key element, and a relatively low or reasonable tax rate, corporate tax rate at 22%. So as a nation, we have a highly educated, relatively wealthy population of early tech adopters. So a good place to do business. I hope that we can collaborate more with the other Nordic areas, and including the Baltics and Estonia. So thank you for listening to me, and I look forward to hearing the other speakers.
Thank you, Jeremy. A lot of good information there, and like you said, I also definitely see a lot of good opportunities for cooperation here. Now, moving on to the next segment, we will have live on stage with me 3 Estonian companies from the health tech sector. We are starting with Dr. Kadri Haljas, the CEO of Triumf Health. Kadri?
Thank you. Hello, all the participants in the virtual event. I'm Kadri, I'm the founder and CEO of Triumf Health. I'm a psychologist by background and I have a PhD in health psychology from the University of Helsinki Faculty of Medicine. Today I'm talking about our digital therapeutics platform for children that sets out to put children in the center of their own health. Now is really the time to utilize the potential of digital therapeutics, especially if these are in an algorithmic form as an application that require no human interaction for administration. This could really relieve the burden on our healthcare ecosystem that is related to the coronavirus pandemic. We developed our solution to fight against the global dramatic increase in pediatric chronic illnesses. Every fourth child is battling with chronic illness as we speak, and these numbers are increasing all the time. The current medical system is really unable to accommodate the growing needs of ill children. And even though all illnesses are very different in their symptoms and in their treatment, they do have something in common, and that's the mental burden. Around 60% of chronically ill children develop mental health issues that are very often preventable, but don't get enough attention before serious problems have already occurred that already compromise the treatment. But these issues need to receive immediate attention. So our solution sets out always to improve three main outcomes: mental well-being of children, health-related quality of life, and patient engagement. We provide comprehensive care in a way that kids really love, through a game environment. In our game, kids need to save the Triumphland city from the disease monster, and through that game we deliver our research-based content to really to educate and monitor and support patients in a personalized manner. Of course, in order to help children, we need to focus on many aspects. Their mental well-being, how their treatment is going. We need to give them information. We need to also give them a sense of success and empower them. These components are all necessary in order to induce behavioral change, but only if these are delivered in a way that kids truly love. And they do love playing games. It's very safe and intuitive for them, and a wonderful environment to reach out to children. You can see on the slides the conditions that we cater to. One of the benefits of our platform is that it is built to scale. We can always add more paths to our application. We are currently working with children who are from the ages between the ages of 7 to 14. Our solution is available both for Android platform and for iOS, so we can really provide this universal access to comprehensive care. And we do this in the native language of the user. Like I already said previously, although all illnesses are very different, the underlying algorithms that we have that really put the patient in the center of their own health, these are universal. We utilize psychotherapeutic methodology and also psychoeducational information really to activate children, to give them this external motivation for them to really understand their how their behavior can change the course of their health and well-being. Of course, it's very important to focus on the evidence basis of our platform. From the very beginning, we started in 2016, and we have had a very strong focus on clinical studies to really show the effectiveness. We started from childhood cancer patients. Our multi-site study that is already published showed that the game improves both mental well-being and quality of life of patients, and also boosts patient engagement. We have, as of today, also finished our multi-site randomized controlled studies among pediatric type 1 diabetics, and we also showed the improvement in the quality of life among children who used our game as a digital intervention compared to those children who received treatment as usual. So we set out to publish these findings later this year. So we have really very little time to publish the findings, but it's very urgent also to show how these digital platforms can improve patient health. In addition to clinical effectiveness and research basis, it is very important also for us to let external evaluators evaluate our platform. So in the UK, there is a health app evaluating organization called Orca, and they evaluate different health applications based on 260 different criteria, ranging from user experience to clinical assurance to data safety, and we received a very high quality mark and are among top 10 solutions for children's health globally. And we are actually on the level 4, which is the highest clinical impact. And based on this, we are actually the number 2 application for children. Our solution is available in various languages, and we make sure that we add more languages and disease paths to it at all times. So just to sum up, we really aim to provide this universal access to comprehensive and effective care that is in a form of an application, so it requires no external human interaction for administration and usage. And we set out to really reduce the ever-growing healthcare expenditures by preventing the development of mental health conditions among children. In response to the coronavirus pandemic, we also extended our platform that allowed us to move further from only from health-related stress to environmental stress, because all children currently are experiencing this uncertainty. Not only children, but we as adults as well. And it's very important to teach proper problem-solving skills that would build up the resilience in future upcoming crises. And research also shows that after every crisis that we have had previously, and now as well, the increase in mental health disorders, both among children and adolescents and adults, is expected. So we really need to set our focus on the prevention of mental health conditions, especially among children, because 50% of mental health conditions develop already in childhood, and these last well into adulthood. So they do affect the quality of life of children throughout their life course. This is the extension. The Triumf and Saga game is the extension of our proprietary platform, where we have disabled some of the components, but the underlying algorithms remain the same. Plus, together with medical personnel and children and parents, we have added this disease-specific knowledge that really helps children to cope better under these uncertain conditions, because they really do need support because they have a lot of different fears. They get their information from social media, and we really need to provide this age-appropriate but also time-critical and standardized information to children. Because only then, if there is enough information that we can give to children, only then they can change their behavior for the better. Because still, even though the whole 2020 we have been talking a lot about the coronavirus outbreak, children still struggle to cope with the new routines that have been placed on them due to the virus outbreak. So in summary, our proprietary platform is now divided into 2 different products. One, Triumf Hero, is for children who have underlying chronic illnesses. So we set out to relieve the mental burden that is related to chronic illness treatment. And it in turn has the potential to affect the treatment and health outcomes of those children. And Triumf and Saga is for children without any underlying health conditions, but any child that is from the age from 7 to 14 who is experiencing environmental stress like we all do, to really help them understand themselves better and prepare them, build up their resilience and prepare them for any future upcoming crisis situations, because children, we are not born with coping skills. We have to develop this over time. So children really need age-appropriate support during those times. So even though our focus is always on children, we also have a very strong business case because the implementation of our platform could result in long-term cost avoidance. So we are preventing the mental health development of mental health conditions. Cost reduction comes from offering a digital-first option for those with early symptoms of mental health disorders, but the implementation could also free up resources, so critical cases can really continue receiving care. And at the moment, we are really on the path of becoming the global leaders in digital therapeutics for children, and we really invite everyone to join our mission. Our seed funding round is open, so investors too get in touch with me if you're interested in investing in us and seeing this as a potential investment opportunity. We are also eager to enter Norwegian market, so all potential collaborators, stakeholders from hospitals, insurance providers, and also schools, I would be very interested in discussing further with you. Of course, I would like to say that there would be no Triumf without our wonderful team of international experts. With that, I would like to say that the team behind the product is highly qualified. And this is it from my side. I'm Kadri Haljas from Triumf Health, and we really aim to place children in the center of their own health. Thank you.
Thank you very much, Kadri. And I totally agree, especially during these turbulent times, mental health is absolutely critical. And with this, we will be moving on to our next guest, the next company. I would like to welcome on stage with me Mr. Priit Kuus from the company Dermtest.
Thank you. Okay, hello. Yes, I'm Priit, CEO of Dermtest. So Dermtest is a digital toolbox for skin and wound care, a complete medical photo management solution. Why do you need to think about medical photos? The reason is that actually medical photo management right now is broken. Doctors and nurses are using personal galleries to store clinical documentation, sharing them, storing them. And this is not a legal problem, it's even more an efficiency and a quality problem. If photos are not available, not shared, not stored, you cannot track the treatment process, you cannot measure outcomes for that. So this needs to be solved. And this is what we have been doing through a number of use cases during the last 5 years. Dermtest is the most easy and most functional medical photo management software there is. We have covered all of Estonia. We have implemented the solution in 4 countries altogether. 55 hospitals and smaller clinics, private clinics use our solutions, and every month about 4,000, and this number is growing, 4,000 clinical cases are managed with the help of Dermtest digital tools. And of course there's a big impact which we have been measuring through different use cases that we make in terms of value and better access and better quality. But what is it exactly? So first of all, Dermtest is a medical photo management software for doctors and nurses who can easily take, capture, store, upload, track, retrieve medical solutions with our software and an app. So, and of course archive the photos securely and in a preferred format or server. It's a standalone solution, but it can be also integrated, and we have done 5 integrations with our solution to different either hospital PACS systems or local EHR systems. Secondly, Dermtest is a patient telehealth support solution. So during the start of COVID, we have finalized our implementation of patient support tool for image transfer. Not always you can make a remote clinical case with with a patient through a video. There are a number of problems with broadband, speed problem, and so on. So we support the high-quality clinical photo management in this situation. So the patient can share their wound or skin problem image before the remote visit or just before an ordinary visit. And we make sure that the quality of those photos is high. And finally, Dermtest is a doctor-to-doctor telehealth solution. So we enable secondary opinion gathering. We have covered all of Estonia with the teledermoscopy system. Another use case for Dermtest that doctors can securely and with proper access right management share the images with a specialist. Either is it a wound nurse to a surgeon or a GP to a dermatologist. And there are a number of other cases from eye care and burning conditions and so on. So these are the core tools of the solution. And what's interesting with this is that it can be used and it provides value to small clinics, larger clinics, larger hospitals, and also to the whole country and region. So this is our sales approach that we approach. In some countries, it's a clinic by clinic, hospital by hospital case. In some cases, it makes more sense to go directly to the insurance covering a specific region or the local government or the national government who wants the medical photo management thing solved and we have the knowledge to cover all the different levels of that. So going to the clinics, implementing this, integrating this, and launching this, and also showing the value why it's needed. So a really different use cases for one product. And regarding use cases, yes, skin wounds are very self-evident, but there's also surgery, there's aesthetics, there's emergency. There is a lot of photo sharing need in rheumatology, oncology, orthopedics, and so on. And all of these images are, of course, supported with relevant patient-reported outcome questionnaires, so the data transfer is complete. And what's unique with us is that we are kind of like a simple solution, although it's pretty complicated, but a simple solution in that sense that it's easy to implement. And it's also useful at the very various level of care provision. It supports patients when they're at home, when they're like contacting a doctor with a phone call, image is needed to add, with video consults, because it's not always possible with a video to get like a good understanding of the skin problem. You need a bit more than that. But also to face-to-face, to doctor-to-doctor collaboration, and we're looking into integrating relevant third-party AI solutions with our API, so that if somebody has built up a really great algorithm for, let's say, psoriasis rash evaluation, then we can integrate this. So covering the kind of the whole pathway of digitalization here. Some of our clients, as total, we have now, more than 50 hospitals and clinics. We have 2 large hospitals from Estonia, East Tallinn Central Hospital and Pärnu Hospital. We have a lot of family doctors where there are a total of 15% of Estonian GPs working. We have also private providers specializing either to skin cancer or specializing to wound care who are using this product. And now we also are moving forward with our kind of quick launch solution to other regions, whether it's Europe or outside. We have kind of find the focus how to easily get started. This is the core thing that you need in order to implement stuff in healthcare. You need to have this easy first step. You should get some feedback. You should get it going, and then you can enhance on this. And this is the case we have now. For example, the last hospital we involved, there were zero visits face to face. It was all online, just a few calls, few visits. Okay, let's go. We need this, and we went forward to the contract and launching after this. So quick onboarding is something that differentiates us. And yes, so far the whole solution has been built, and we have focused on Estonia mostly because we wanted to cover the whole kind of use cases, the relevance from the country perspective and clinic perspective that we have. It also really scalable, and when building our security and integration compliance and possibilities, we have also thought a lot about sharing this, a lot about going to other countries. Different privacy needs are there. EU is simple due to GDPR. We have certified the software for GDPR compliance, but in other countries, sometimes you need the local server, sometimes you want a central server. So we have all these options available. And deep collaboration with clinicians and doing research. So based on the solution, of course, the solution itself is more about image management if you look at the solution, but actually there are strong clinical cases back there. And we are currently in 2 studies evaluating Dermtest impact on skin cancer screening. As said, we have covered all of Estonia for teledermoscopy, supported it with the Dermtest image management. So seeing the actual impact of solving the photo management in healthcare systems. So and working further than this. So yes, thank you so much for this opportunity to share Dermtest. If you think this is a good thing, come talk to me or just contact me online, and we can figure out how to solve the broken photo management situation in the world with our solution. Thanks.
Thank you very much, Priit. Very exciting to see technological advancement in this particular field as well, where we think that skincare, maybe what's so special about it, but very, very exciting technology on that front as well. We are now moving forward to the 3rd Estonian company. I would like to welcome on stage here with me Mr. Mellik from the company Cognuse. Andres?
Hello, everyone. My name is Mellik. I'm the CEO and founder of Cognuse. We're a digital health company. We've been around for a few years now. But I would like to start the presentation of the personal story. As you can see, less than a week ago, I had surgery performed to reattach my biceps, which was a basketball accident. Everything went well. The surgery was a success, but unfortunately, it was almost a coin flip statistically, as 4 out of 10 patients in healthcare are actually harmed in the actual care settings. And that's due to deviation in care, adverse events, and so on. Some of it is, of course, accidental, random, definitely not intentional. And the hospitals are addressing this issue in a number of ways. The biggest focus is put on standardization of care. So basically, hospitals are creating a lot of content, protocols, guidelines, checklists, and so on to address the issue. But the problem with that is that that content is inaccessible and non-actionable when and where it is needed. And it is actually creating a huge overload of information on the nursing staff. And those adverse events, medical errors, and so on, are resulting in something which is called unwarranted care variation. And that's actually the biggest or largest internal cost driver for hospitals worldwide. We've been validating this problem in over 100 hospitals for the past 3 years, and it really is a uniform problem across the globe. So what did we do to address this issue? So we essentially created a 2-part system. We completely wanted to transform the way the content is generated, updated, and distributed to the staff, and also the front-end interface, meaning we created a mobile application which can be actually guided through the person's voice or the end user's voice, as well as through a visual interface. And this actually pertains very well to the infection measures that hospitals have put in place worldwide, so where you don't have to touch anything, but you're essentially receiving these real-time, step-by-step instructions in your ear as you're doing the procedure. So, working with a number of hospitals over the past 3 years, what we have found out that actually this is a very useful tool for a number of use cases. specifically novel situations, rare procedures, night shifts, when there's less staff available often, and they are more tired, more overwhelmed, and also learning and training and onboarding of new staff. As well, with the largest hospital here in Estonia, we're implementing this for blood transfusions, which is one of the most critical procedures, so that every single blood transfusion is actually covered with our solution. As well, it actually expands also outside the hospitals. So nurses, yes, are the primary focus group for the application, but we're already working with a nursing school in Germany, a few nursing schools in Estonia, to address those academic processes as well. And for instance, it actually spans outside the hospital completely into the general population, where family members are able to take care of severe stroke patients after they're discharged with the same curated evidence-based content that would be used in acute care or long-term care settings by medical professionals. When COVID hit, we were actually getting a lot of inquiries for our platform. And of course, the effect of COVID is well known, especially on the healthcare staff. There's a lot more burnout detected in them. The demand for healthcare services and capacity is growing still, now in many countries with the second wave. And hospitals are looking for ways to avoid unnecessary contact between the infected patients and the staff. So we actually jumped on the opportunity to develop the platform further. We added cognitive test measures, gauging burnout and performance in the staff, trying to make the processes and procedures more efficient, time efficient, resource efficient, as well as we're developing a communication feature for the COVID departments or infectious patients and the nurses. So primarily we're a SaaS-based business, so we are pushing this as a software as a service to hospitals. It's a B2B business model. We're working already in 8 different countries with this. So this basically, the first column details the market potential for that, as well as the market potential for the whole world. And especially in the last 12 months, we've seen a lot of traction, both working with large international organizations such as GIZ, which is the German foreign aid organization in short. The Red Cross, we're collaborating with them in Kenya. Philips has been our soft partner for the past 3 years. And a number of other collaborations are actively in play. And as I mentioned, 8 different countries at the moment, ranging from Chile and Colombia to Germany, Estonia, the UK, and all the way to Africa, where we're working in Kenya and Ghana. Obviously, we couldn't do this without a great team. So myself, I have a background in e-learning solutions before, which was my first company, and really a lot of the concepts can be transferred into digital health as well. Carmen and Flavia are neuroscience graduates from King's College. Jürgen has been working with content transformation or instructional design for the past 10 years, probably one of the best at that in Estonia at least. And Jeremy is one of our advisors from the US, and he used to be the youngest IRB chair at Mount Sinai in New York. So really a very strong team to go after this vision. From the ask side, we have raised funding before. We raised close to 1 million already 4 years ago. Since then, we've been self-sufficient, but we've now reached the stage where we need to scale up. And obviously, our business is very much an impact business. And to that end, we are working to execute our impact measures, also in collaboration with UNDP, so that they would also globally adhere or comply with the Sustainable Development Goals that the UN has set forward, as well as the Draper University. And we're actively looking for a $3 million scale-up round, and it can be comprised of both non-dilutive and dilutive sources. And obviously happy to talk to any of the hospitals, healthcare providers, as well municipalities and professional organizations in Norway, and any investors, especially the ones which do have impact investing as part of their strategy. Thank you very much.
Thank you very much, Andres. It is absolutely great to see how your solution is helping everybody, especially the medical sector during this COVID crisis and even beyond. And now we will be moving to the Q&A session. I will have all of the companies on stage here with me. And just to remind you, if you have any questions to any of the companies, please use the Slido app. All right. So, welcome again, everybody. It is very nice to see all of you on stage here with me. And I thought maybe we can start with a more general question, since we all know in what kind of a let's say maybe we can call it a crisis situation or however we want to call it that we are in right now. I was wondering to get your opinion on the situation, especially in the terms of what do you see are the greatest challenges that we are facing at the moment in the health tech sector? Kadri, maybe you can start.
Sure. I think that it became really evident in springtime that these kind of virtual visits were very beneficial and patients were very happy with those. And for example, in Estonia, 1/3 of all visits were conducted virtually in spring. But we still lack this discussion on algorithmic solutions that require no human interaction, even if it's virtual. And I think that it definitely will happen, I'm sure. There is a huge potential for digital therapeutics in general. But we still, there is a little bit of mistrust related to that. So I think that that's one, because I'm representing a company also that is in the field of digital therapeutics, that's definitely one of the challenges.
Yeah, I agree. It's COVID provided like a very, very, very colorful use case for the whole society or the world, why different digital health solutions are needed. So there were all the angles from early detection, epidemiology, tracking, treatment, remote care, so on. So I think one thing is just that we need to learn really quickly from this, but also we need to think about what kind of is behind this. And what don't we see right now? Because healthcare has a really strong inertia, and yes, I also agree that we the countries now we're going into remote care and virtual visits quite a lot, but this is half the solution. We should go also to asynchronous care, tracking patients without the need to kind of go on video and talk 20 minutes with the doctor. Rather, how can we gather information along the way during the chronic care problem, which can be years, and share this data to the doctors in a really kind of efficient way. I think there is the most value if we measure this, but there is it's much more than the current situation. So I hope that in a few years, when the whole thing is more past us, then we have more time to focus on these areas, which was actually a problem before COVID also, but now maybe can be highlighted.
Mm-hmm.
Yeah, I definitely agree with the previous responses. From our perspective, as we are more inside the hospital and interacting with the healthcare teams, which have now been put under enormous pressure globally. So what we've seen is that, of course, they have to be much more effective now, because essentially there are less resources in terms of staff, for instance, that is being infected as well. And how do they respond almost immediately to these kinds of pandemics? So from our perspective, what we basically offer them, for instance, is a way to, with a flip of a switch, to change all protocols into kind of an emergency mode, so that all of the staff is immediately can get the right information that they need. For instance, different procedures like tracheostomy, which I also had to go through last Friday, for a kind of a highly infectious setting. It becomes very different how you handle that procedure. So being able to support them in kind of saving resources in these critical times, I think is also important.
Thank you. Very interesting stuff, and I guess from all of your answers, one of the things that I picked up is that these digital solutions also very much enable to do a lot of things remotely. So especially in these kinds of situations that we are right now. Am I right in saying that these remote solutions are becoming also more and more important?
Well, definitely. But I think it's just half the problem to put the typical 20-minute doctor visit into remote and think that we have used all the capacity of technology that we have. It's I think. This shows the pluses and minuses of going to remote. The healthcare organizations have to refigure how they provide the services, and I think more and more now, like insurances countries, at least in Estonia, there's a lot of talk about value-based healthcare. How do we measure things, and how, as an insurance, we don't incentivize just plain one-on-one visits with the patient, but rather we incentivize gathering the data through a longer period. Kind of, for example, with psoriasis, also skin disease, you need to have constant monitoring. If something comes up, there are maybe adjustments needed to the regimen, to the treatment. But if there's COVID on, if all the times are booked for the doctor, then the hospital has no way how to triage the relevance. But if we track all the patients and let's say just put some of the patients on DOP because they have very bad adverse events, then the healthcare system can be more proactive. But gathering this data this has to be figured out.
Maybe I can just also point out from the perspective of mental health why these remote solutions or virtual visits will not solve the problem that we are currently facing is the fact that if we have a situation of a lockdown and everyone is at home and it's very difficult to talk about mental health, especially when we talk about children and when they know that their siblings or parents might hear what they are discussing with their doctor, then they are hesitant in doing so. So there are various available solutions for monitoring and supporting mental health that require no audio to do that or require no talking, and is that way also much more delicate and easier to use for people, because it is really difficult to talk about mental health, especially when you know that someone might hear what you're discussing with your psychiatrist, for example.
Definitely. Do you want to, Anders, you want to add something?
Yeah, so I would take the word remote in a completely different context in terms of our businesses actually and companies as we are, is that one thing that COVID has kind of proven is that it is completely possible to also remotely implement these solutions. Because prior to this year, I was having maybe 120 flights each year just to meet with the people, to establish relationships, worldwide basically. But now we've been able to do all of those things and actually much more completely remotely because everybody accepts, and there's much less kind of this organizational navigation and all of that going on. So all the people are able to be, in the Zoom kind of room at the same time, and that has actually helped us a lot. It has nothing to do with remote delivery of the healthcare service itself, but you need to get these solutions to those hospitals somehow or healthcare providers. So that's another word of use for remote.
And again, what I'm I guess picking up from all of your answers is, yes, the digital solutions and then the remote solutions, they help a lot. But am I correct in saying that that a human element, especially when we talk about healthcare, is still very relevant, even when we use all of these digital solutions?
Well, it depends. If I can start, for example, our solution requires no human interaction whatsoever to administer the solution. So it really provides this universal access to care But there is still a lot of because we don't, or the stakeholders don't know exactly what is happening in a solution that is purely algorithm-based. So it's very difficult for them, without really fully trusting it, to suggest this to their patients that that this might help you to prevent this or that. So it requires a lot of kind of trial and error, and really having a discussion in the society with healthcare professionals to change this, because there is a possibility to also really relieve the huge burden that was said before that the medical personnel is currently having, and with limited resources that they have, it would be wise to try different solutions that might help them to focus on critical cases.
Yeah, I mean, because I've also been in the digital therapeutic space before, then I also think that it's very domain specific on where the physician or some other healthcare provider should be involved. But there are definitely lots of opportunities now for purely digital solutions. And I think Germany has now made a very good steps towards that. There are a few of those solutions reimbursed. I think other countries should follow suit. There are also some VCs who are investing only in digital therapeutic ideas where the physician is not involved. So I think those are very interesting trends.
Yeah, I also want to point out the German example what Anders showed. That I think there is now understanding that digital therapeutics is possible. There is evidence has piled up. Like in healthcare, you always need to have evidence. You need to figure out whether this this solution actually helps people. So doing a lot of research on the solutions before is important. But yes, I think the market is getting ready to involve more digital therapeutics. And the healthcare system is also understanding that it's possible to put those fully automated solutions into the care pathway, and in that way also support the human contact and make the human contact actually more complete and more better, because it's not about treatment, but it's more about understanding the patient and talking with the patient. So, but if otherwise the time can be spent in a way that it's everything is automatic, adverse events or whatever, like prevention and tracking the patient's health, then it's much. In any way, the healthcare systems are under pressure, and we need to go in this way. Now the question is whether governments will enable the reimbursement of such solutions, and whether the care providers and the health systems are able to put those solutions into the treatment pathways in a very sensible way, so that everything, the pathway of the patient treatment has to be thought through. And all these things have to be thought about. The governments who manage the healthcare system and hospitals, it's not easy, but now we have a lot of experience around the world how to make it, and we just have to figure it out.
So the digital won't necessarily entirely replace the whole experience, but it will definitely add and provide a lot better solutions to complement the current system and to improve on the system that we had so far. Exactly. Yeah, very very interesting. And this actually brings me to the next question. So we see a lot of these digital solutions being rolled out, especially recently with the pandemic and otherwise as well. Do you see it as an issue that there are so many digital solutions where some of them might not have actually been tested through or applied research to the whole process of developing these tools, or is it not an issue? How do you see it?
Well, it is definitely an issue. I mean, everyone is trying to make a difference now in the healthcare field with all kinds of different digital tools. And in spring, like nobody had any time to conduct any research based on those tools. And I think that it makes the life a little bit difficult for medical personnel as well, because there are so many solutions to go through. Fortunately, there are a couple of platforms that help professionals to evaluate or make like informed decisions based on the solutions. But it is definitely difficult because it takes years to conduct research, but we have very little time to launch new solutions or kind of modified existing solutions to correspond to the current situation.
Yeah, and it's like validating the solutions, making sure that they don't do harm. This is a very, very important role. But it's also important to make sure that we validate and evaluate the solutions at the right level. So if during COVID, the main technology for remote care was telephone in all around the world, we're saying that, okay, we went to remote care, but actually 95% it was a telephone. Even in like top digitalized healthcare systems around the world, telephone. So, and then there were also like Skype and Zoom and so on. And another question is whether we should do a complex randomized control study to telephone and to Zoom and to Skype. No, we shouldn't. It's not that complicated. Whether we should do a complex study to like a solution which actually suggests treatment and drugs and when and where to go and alerts your like whether you will have some kind of attack in some time. Yes, this might have a very big cause. And I think right now the health systems, so for example, Estonia also adopted the NICE digital health framework guideline, which makes kind of diversifies how much validation healthcare solutions should have. So with the simpler solutions, they should be validated, they should be researched, but not to that extent. But the complex ones, which have a very big effect effect on human life, they should be validated rigorously. And I think all countries should have these kinds of different criteria. I think the NICE UK guideline or the framework is pretty good. Estonian Health Insurance Fund has also adopted the NICE framework, and I think that also the Danes are thinking about this and some other countries. So it makes it clear. So we should kind of have the enthusiasm what is in people. Let's solve something in healthcare. This should be matched with like, yes, if you want to solve something in healthcare and if you want to solve this, then you should have this kind of this level of research done to your solution. It will save a lot of time and nerves and money from each side if we know like how complicated solutions to build and how to validate and how to research them.
Mm-hmm. Absolutely agree.
And I would perhaps only add that completely agree with the previous responses again, but I would also add that I think what is being overlooked is actually the kind of the soft measures or the soft benefits that these digital solutions bring on top of the clinical sort of efficacy. So if it's something that is equivalent to a kind of a physical doctor's visit, then usually, or replacing it, then usually the digital solution brings a lot of logistical cost effectiveness benefits as well. And I think health insurers perhaps are looking at it on a government level. I have seen that it's not as well accepted that this is something that should go into the equation, like saving people time on their transport, money, having to leave work for their kids or whatever. I mean, all of those things have to go into the equation, I think, because it's a huge impact.
Absolutely. And I think actually for a final question to all of you, maybe even let's say a little bit philosophical or however you want to put it, where do you see healthcare and the whole health tech sector moving in the coming years? What do you see as the future trends? What will the future bring us, in your opinion?
you've been the longest in the sector. So.
Yeah, well, I would like to skip the the obvious buzzwords of personalization and those things. I mean, personally, I hope to see more kind of sensible digitalization of kind of obvious care pathways where it can be, implemented, and it's obvious to us, but it's not definitely obvious to everybody else always. So in healthcare, I think many of us have, in doing our or building our companies, we've constantly been like 3 to 5 years ahead of the, kind of the acceptance curve as we were building it, and now it's I think it's getting closer and closer. And I would like to also see more acceptance on the kind of provider side, and I think that's coming with time. So as literally the healthcare providers and professionals who've grown up with a lot of this technology already, naturally, they are much more accepting to the benefits that it can bring. So that will probably increase the uptake. But of course, we have to support the whole spectrum of healthcare workers. We cannot just focus on the above 50-year-olds or whatever. So, but yeah, I mean, but I don't have any precise predictions because I would probably be somewhere else at the moment calculating them if I really was good at that.
All right.
Yeah, I mean, I could say that yes, we need a bit more visioning now. We need a bit more better frameworks to kind of like find the balance between what can be built at the central level, what rules and what infrastructure, what architecture should be made by the governments who have the regulatory controls, who can say that like this solution should provide this, validate it like this, and should connect to the central information system which we have in Estonia with these rules, so that we, when we build a lot of different stuff, that they in the end start to communicate with each other, and there is no other place that can kind of induce this communication between the solution is still the governments at different levels, so EU level and so on. Another thing I think what's gonna happen is that yes, we're gonna move more to digital therapeutics, and this is. And we will be able to understand better how to connect those digital solutions to the framework. So usually everybody started to go into the market with the kind of the whole context, and then finding out that the client that okay, you have solved this part, you have solved this part, but you haven't solved like one component what we are having. But then you start to understand that okay, let's make our components so that we can attach them to your system. So I think interoperability aspect, how these different solutions communicate, this will make it easy to adopt them by different hospitals. This is also a message to myself and other digital health builders who are building something, and they have to think about how this will be connected to the kind of central and hospital and provider information system. So, like it's about the plugs, simply.
Yeah, very interesting.
May I build on top of Priit's response, because that was what I wanted to say, but I mean, we are still very unhappy when we go and see a doctor. We are seeing a lot of innovation in all kinds of different areas of life, but the medical visits are still, we are sad that, or we feel like the doctor is seeking information and entering information more than interacting with us, and it's it frustrates people quite a lot. So if we have this possibility of integrating a lot of data from patients that is trusted by clinicians, that makes the medical visit more effective, but also if we can involve different types of digital tools to already prevent something, it can be done by algorithms, by artificial intelligence. No human can go through all of the information, but we should look human, one human being as a whole, throughout the treatment process of different conditions, because that's the key of successful treatment also, because it induces this kind of behavioral change among people that they are taking more active role in their health and what they can do with their own behavior instead of building different or like adding more and more medications to their system, for example.
Excellent. Again, I absolutely have to agree. With this, we will end our Q&A session for now. Thank you very much to all of you for participating. To our guests in Norway, as you can see, we do have a lot of interesting stuff going on in the health tech sector here in Estonia, and a lot of good ideas and opportunities for the future as well. Now we will actually move to a short break, but this doesn't mean that we are switching out. We are actually having a very special musical treat for you. This is not a recording, coming to you live from our studio in Norway, Mr. Aksel Kolstad.